Hi, my name is Dr. REINBOLT. I'm a physical therapist here in Salinas and Monterey at Balance Physical Therapy. I'm a pelvic health specialist, which means I see a lot of people with some difficulties coordinating their pelvic floor and their abdominal muscles. Today I want to talk about what's called diastasis rectus abdominis. So I'll show you that here in just a moment. This is, a condition that can affect people that have recently had babies because you've gained a lot of weight here and it's going to stretch those abdominal muscles. But it can also affect people that have gained a lot of abdominal weight or people that are doing a lot of lifting and aren't able to control their midsection well, as well as people with connective tissue disorders. So we're going to look at the abdominal muscles here. So I've kind of cut some TheraBand here. So your rectus abdominis muscles run from your rib cage to your pelvic floor to your pelvis, and there's a little line between them called the linea alba. So when you get pregnant and you have a baby growing, there's going to be pushing on these rectus abdominis muscles, and now you have a separation of the muscles. So generally this should start to come back together after the baby's been delivered, but sometimes there's some difficulty with coordinating this motion and bringing it back together. And there's some loss of tension in this linea alba, and that can create difficulty with coordinating these muscles. So I'm sure we've all seen pregnant women try to get off of their back. It's kind of like a turtle trying to get up. That's why these muscles have lost their strength. So I'm going to talk about some exercises you can do to improve the coordination of those muscles and help bring that separation back together. I'm also going to show you how you can test for this motion at home. So this is actually something you can test for yourself at home. So all you're going to do is lay on a flat surface, bend your knees. Karen, I'm going to have you take 2 fingers and place them close to your belly button there. I'm going to be doing the same thing a little lower down. And so go ahead and relax your head. So you're going to push with a little pressure downwards. And now Karen, I'm going to have you lift your shoulders up off the table. Now somebody that has a diastasis rectus, go ahead and come back down, is actually going to have bulging, or they may have sinking down of that tissue. So Karen does not have one, so everything stays nice and strong and supported here. But somebody that does have one may be able to sink a finger or 2 in there, or maybe even up to 3 or 4. If we're getting up to 3 or 4, you're probably a good candidate to go talk to a surgeon. But if it's 1 or 2, this is definitely something that can be rehabilitated. So next, let's go into some exercises you can do to help at home. So the first exercise you can do at home is called a bent knee fall out. So Karen's going to contract her lower abdominal muscles. She's going to think about putting on a tight pair of pants, or like if somebody was going to come hit you in the stomach with the ball, you'd kind of tighten up here. She's going to bring her feet together and keeping this muscle nice and contracted here. She's going to keep her back flat against the table and slowly let this leg come out to the side. Good. And then back in, and then back to the other side and back in. So although this doesn't look very challenging, if she's doing it correctly, I'm going to have you keep going here. She's going to be contracting these muscles and keeping her back flat against the table. If you're noticing that you have a little ridge here and you do have a diastasis, take a break, try to contract again and see if you can make that ridge go away. The second exercise you can do is a supine ab march. So you're going to do the same motion as the exercise before. You're going to think about tightening your lower abs. Your back's going to stay flat against the table. But instead of letting the legs come out to the side, you're going to think about marching this leg up off the table to about 90 degrees, just a little bit less, perpendicular with the floor. She's going to keep it there, and now lift this right one up off the table. Good. She'll come down with the left and down with the right. Karen, I'm going to have you do one more. She's doing a great job of keeping everything very well controlled. She's not bouncing up and down off the table. Her legs are falling silently back to the table, and I don't see any ridging here again. The last exercise you can do at home is called a bird dog. So similarly to the last exercises, Karen's going to pull her belly button in a little bit. You can think about a bowl of soup on your back that you don't want to fall out to either side. She's going to keep her core contracted, and slowly, she's going to slowly lift one arm up. Very good. Back down, and the other arm up. So Karen's doing a great job. I could balance a cup of water here, nothing's moving. If you're noticing your back falling side to side, you need to work on this contraction a little bit more. Something that you can do at home to see if you're doing it correctly is to place a foam roller over your low back and keep it there. To make it a little harder, you can also add a kick backwards while moving your arm. This is more challenging, so make sure you get the arms down before you add that second part in. Diastasis rectus can be treated at home, but you should see a physical therapist or a medical doctor to get that diagnosed. Now, if you found this video helpful, you can visit us at balancept.com, follow us on Instagram at balanceptmove, or hit the button below and subscribe. Thank you.